Well, it's time now to get a brass tracks as we usher in our first guest, Professor Chumy Nwogu, a professor of surgery and oncology, chief executive and chairman of board of the Foundation for Cancer Care, a non-profit organization in Nigeria which seeks to provide free cancer education, screening and treatment services to as many Nigerians as possible. Well, good morning and welcome to the morning show, Professor. Thank you for joining us this morning. Now, tell our audience really the motive for your foundation. How did you start it? Where is it at the moment? And what have you achieved so far in terms of educating Nigerians to get free cancer care?
Thank you very much for having me. I'm really grateful to be here. Our foundation really wants to educate people about cancer. Let people understand that this is not a death sentence. It's not something that comes because you've done bad things in the world. That it's a disease that can be detected early. It can be prevented, it can be treated successfully. So the foundation really focuses to go out there and really bring the knowledge to the people. So far what we've done is that we helped establish the first private cancer center in Nigeria, Lakeshore Cancer Center. But we've also gone out there to really tell people about these cancers that plague us. Things like prostate cancer, breast cancer, cervical cancer, colon cancer, and that some of these things can be prevented. But one of the big messages that we're trying to get out there is that people should be screened so that these things can be detected early and they can potentially be cured. So that's a big message that we have out there.
Okay, I mean, that's a great one that your foundation is doing. But when you talk about screening, is it free and where is it happening? What is the process for the general public to get screened?
That's a very good question. Cost in healthcare is a big issue.
It is.
We can't get around it. One of the things we're trying to do is to raise money so we can provide free cancer screening. We would like to be able to have a mobile bus going around various communities, especially people that really can't afford it, to be screened and also to be able to be supported to get treatment. So our focus is on the indigent population, to be able to provide these services for them free of charge.
Where are you referring to when you say indigent population? Generally in Nigeria, in Lagos, or where?
Well, you know, charity begins at home. You know, we're based in Lagos, so we start in Lagos. Okay. Some of the outreaches we've done, for instance, recently we did an outreach to market women in the region to go and do mammography, that's breast cancer screening, very close to where they have their businesses daily, so they don't have to go far away to get screening. So those are the kinds of things we want to promote.
Well, I'm looking at Lakeshore Cancer Center. It is in Victoria Island, correct? Yes. And so what are your plans? I know you said that you have you want to try to get this mobile vehicle so you can go around. Is it just within the metropolis of Lagos or Abuja? Are you going within the urban centers? Because I mean, I believe that is where the care is really needed at this point.
That's an excellent question. Right now, we are located both in VI and Ikeja. We spread to Ikeja to bring it more to the mainland. But our goal is to have multiple cancer centers all across the country. We need care in every corner of Nigeria. So that's our goal. But again, you have to, a journey of 1,000 miles starts with one step. So that's where we are.
When we talk about education for cancer, it is very important. Like you said, early detection is key. Now, what would you like our viewers to know in terms of not just the idea of early detection, preventative measures people can take in terms of cancer? I mean, different types of cancer. I mean, I want to even start with women. Breast cancer, ovarian cancer. What are those measures?
Well, some of the simple things for people to do for women, for instance, breast cancer, is to understand how to do monthly self-breast examination, okay? Things like that, so that if there's a little lump, you detect it and you can have it evaluated early. Things like cervical cancer, which is another problem for women, there are vaccines available now for young women to be able to prevent the human papilloma virus that causes cervical cancer.
HPV.
For men that have prostate cancer, also getting PSAs when you're 40 years old and above, getting yearly exams by your doctor. These are some of the things that are very important for both women and men. So those are some of the things I would highlight.
Okay, how bad is cancer generally, particularly in Nigeria? What is the data saying? Because I know that all through 2020, 2021, maybe a bit of 2022, COVID was, the buzzword. And it looked a bit like almost every other thing practically disappeared. You have a little headache, check COVID. You're dealing with cancer or diabetes or everything, check COVID. Are we back to normalcy and to a stage where people who have issues, medically, are now dealing with the things that they have always known that they have, cancer, diabetes, etc. How bad for cancer is it in Nigeria as of today?
Thank you very much for that question. Cancer is a huge problem worldwide, and it's more of a problem in developing countries like ours. Essentially, 70% of cancer deaths occur in developing countries. Part of our problem in Nigeria is that our data is only touching actually the tip of the iceberg. How many people get their proper diagnosis when they have problems? But it is a major problem. Worldwide, cancer causes more deaths than HIV, malaria, and TB combined. So it's a huge problem. So it is something that we need to pay acute attention to. So our biggest problem in Nigeria is late detection at a stage where treatment is not as effective. So our hope is to move that kind of issue so that people can be detected early where their treatment can be effective.
But what do you say to people in this part of the world who are, I don't know whether it is cultural or religious or a combination of both, but who are just afraid to want to explore? What people would naturally, normally tell you is that once you go to the hospital, they will find something. Why, therefore, do you want to bother if the thing is not affecting you? I know that is wrong medically, but how are you tackling that in terms of advocacy?
Yes, one of the biggest things we hear is that it is not my portion. That is one of the famous phrases. But the reality is that this disease can affect anybody. And kind of sweeping it under the carpet is not going to solve the problem. It's better to pick up things. We all want to be there for our loved ones, our family, our children. So the quicker we detect something, the more likely we'll be able to get rid of it and continue with our lives for our loved ones.
Absolutely. I want to ride on your question in terms of it's not my portion and all of that as well. But also the point of alternative care. Now, I know that, scientifically there's only just radiotherapy that you've told me about. Also, we've talked about surgery. But people do believe in alternate care. And a lot of people have survived through alternate care. What is your advice in terms of care for cancer?
Well, I would emphasize that the common things that are good for health, healthy diet, exercise, avoiding of excesses like alcohol. We're not saying don't drink alcohol at all, but in moderation. So plenty of vegetables, fruits in your diet. These are all things that are critical for good health. And they're also useful in terms of prevention of certain cancers. So I would really encourage people to embrace all the things that promote good health. But it's not like we have a magic bullet right now that, if you take this herb, the cancer is going to disappear. We don't have that. So it's important, yes, to promote good health, but at the same time, there are some scientific remedies and strategies that we definitely want people to embrace. Cancer is not a death sentence. It's important, even if somebody is diagnosed with cancer, a third of cancers can be prevented, a third of cancers can be treated effectively, and a third of cancers, people can have quality of life, even if it's palliative care. So I would emphasize those things.
Yeah, but when you say all those can be prevented, can be treated,
yes,
can it be cured?
It can be cured. Cancer can be cured if it's detected early. So that's why we're promoting really screening, so that if it's picked up early, there's the potential for cure.
Now, when you talk about herbs, I'm very particular about alternate care.
Okay.
I am only saying this because I've, told several of my guests that, I speak about cancer. My mother recently died in September from cancer. I mean, there was early detection, and she survived cancer because she had surgery and all of that. But also, chemotherapy stopped working for her at a point, and we had to do alternate care, which was like, we had UV rays and sauna treatments and, vitamins and all of that. But the center that we actually used, they have been in operation for years, and some have survived through that type of alternate care. Is that something that you might look into, or is that something that you want to just take out of the question in terms of care?
We always embrace options, things that can help our patients. I am not an expert on alternate care. I really believe in people speaking to their expertise. So I would not discount the value of things like herbs and vitamins and things like that. So I would not discount that. Okay. But I'm not in a position to be able to give specific advice on an area where I don't have expertise. There are some things that are well documented around the world from scientific studies that I can speak passionately about, but I would not, want to, say things that I don't know.
Okay. Yeah. All right. Let me ask you about things that I'm sure you'll be comfortable speaking about. Yeah. And the two-pronged thing. First, I mean, your foundation, of course, is a non-governmental organization.
Yes.
You've been raising money. How much of support are you getting both from the private sector and the public sector to do what you're doing? And if it is enough, I know that money is never enough. That's one. And the other two is in terms of quality care and expertise. How much of those is coming from Nigeria at a time now that people are basically into Japa? Most of our medical personnel, just want to travel back. But here you are trying to give something back to the country. Do you have enough of personnel in Nigeria, and are you satisfied with the quality that they are bringing on board?
That's a very good question, and I'll try to really cut to the chase. We definitely need more support. I must emphasize that we're trying to raise money. One of the things that we're doing is that we're having a fundraising charity golf tournament actually in less than a week. On Friday, May 26th, at the Ikoyi Club 1938, we're having a charity golf tournament. We're hoping that we can get support, and we're already getting support from a lot of individuals and corporate bodies. We do have a lot of Nigerians who are coming back from out of the country, bringing their skills, whether it's surgeons like myself, medical oncologists, radiation oncologists. There are some that are homegrown also that are very talented. So there's a lot of effort to work together. Cancer care requires a lot of collaboration. It's not a solo exercise. So private sector, public sector, we're all working together to tackle this big challenge. It's not an easy thing. It requires a great team to accomplish that.
That's amazing. Also, I mean, you're a professor, you're also a surgeon, like you just mentioned. And Steve has talked about the Japa syndrome. Only recently, the health center was inaugurated in Aso Rock by...
it's a 21 billion facility, by the way.
21 billion naira facility. At first, what do you even make of that? Do you believe that presidents wouldn't have to go on medical trips anymore after we've had this medical center inaugurated?
Well, it's great. The more we have in the healthcare field in terms of facilities in our country, the better. But I always emphasize that it is not the building, it's not the machines that are the most critical. It's actually the people. So whether it's the doctors, the nurses, the allied healthcare workers, we need to kind of build capacity. That's a big need. So sometimes you have a big hospital that is out there, but you don't have the staff. So that's an effort collaboratively, the private sector, the public sector, we're trying to build capacity. But we embrace investments into the healthcare field. We also hope that our government can encourage doctors from Nigeria all over the world that have achieved so much to be able to come home and provide those services for our people. Yes.
How much trust do you think that, not an average Nigerian, but those, the type that, Oji was trying to refer to, public officers, those who are in control of the country, how much faith do you think that they can have in your own facility, for example? Part of the problem that we have always especially in the last 20 years or thereabout, has to do with leaders always going on medical tourism abroad, whether those who had been there or those who are there now, or those who are trying to come in. The medical tourism thing has always been part of what defines their legacy. We have good news, and people like, of course, Professor Yemi Oshibajo, the Vice President, who had a surgery successfully in Lagos, a few months ago. You have a center which looks after people's, care, particularly in the area of cancer.
Yes.
If those in charge of the country were to be your patient, how much faith do you think that they can have in your facility?
That's a great question. We're already seeing that. Many of us have come back from out of the country. When people go out of the country to get care, a lot of times it's Nigerians that are providing that care out of the country. So I mean,
Nigerians and Indians.
So I personally go back and forth between the U.S. and Nigeria. So the care that people want to get outside can be provided successfully here. We definitely need more investments to maybe upgrade some of our facilities. I work at Lakeshore Cancer Center, one of the private cancer centers available locally here. We definitely need funding for expansion to provide more services. There are many things that we can do here to the same quality as out of the country. However, there are still some areas, some very sophisticated surgeries that we would like to be able to perform here that we can't do here yet. So I'm not claiming that we can do everything.
Like what? Like what?
No, I mean very extensive liver resections, pancreatic resections, things that are very sophisticated. Wow. Yes. So, but there are things that we can do here also. I'm a thoracic surgical oncologist, so we can do big resections or in the chest here, do them successfully. So I do that frequently when I come here, but we still have ways to go. We're making great progress. We have excellent doctors that are available here. We just need help in terms of funding to be able to bring all our skills to bear for our people.
All right. So this foundation, or this, you're having an event
on Friday.
On Friday.
Yes.
How much do you intend to raise?
We intend to raise 200 million naira. That's our goal. Okay. It's a big goal, but we want to have a mobile breast and cervical cancer screening bus that will go from community to community, being able to screen people that really can't afford it, bringing it close to them. We also want to be able to support people in their care, the indigent population in particular. So those are the two things we're aiming to accomplish from our fundraising.
Okay. All right. And the Jagba syndrome and building capacity, is that sort of a place that you look at in terms of advocacy to have Nigerian doctors return home?
Yes, that's something we definitely promote. We have successfully recruited a medical oncologist who trained in the UK and practiced in the UK to join us. Doing very well at Lakeshore Cancer Center, and we encourage more people, to do that. So that's an example. Dr. Nwogu is a fantastic medical oncologist at the Lakeshore Cancer Center. Those are the type of people we want to bring back home, bring their skills, because Nigerians just are fantastic all over the world, and we want to bring those skills back home.
Okay. Just before we let you go, because we've run out of time, how much of collaboration do you have with any levels of government, maybe Lagos State Government, Health Ministry, for example? Any collaboration with them in any way?
We have been reaching out in terms of, we're looking to work with the Lagos State Government in terms of what's the best way to really get, vaccination against HPV to, young women and girls, to try and prevent cervical cancer, things like that. So there are ongoing efforts to collaborate. You know, we do have educational programs where we've worked with LASUTH in the past. We do have programs with LUTH. You know, we work very closely with the NSIA, LUTH Cancer Center. So it's a team effort. Nobody can do it alone. So that's part of our philosophy.
All right.
Fantastic.
Thank you.
Well, thank you very much on that note. We'd like to thank you very much. And I hope that you're able to raise the funds that you need by Friday. Well, good luck to you.
Thank you very much. Thank you for having me.
Thank you so much.